Hi, my name is Gavin Francis. I'm a doctor and writer based in Edinburgh, and it's a great pleasure to be here in Lerwick at Wordplay Festival 2021. And I've been asked just to read for 3 or 4 minutes about my new book, Intensive Care, GP, a Community and a Pandemic. And it's about my work as a general practitioner over the last 18 months of the pandemic between Edinburgh and Orkney, and working in different kinds of general practice settings. I was going to read a short passage, a page or so, from early in the book that sets the scene, and then I was going to read a little passage from near the end that kind of sums up a little bit of what I hope people will be able to take from the book. My ambition has been to chart the evolution of this modern epidemic as I saw it, as a GP and as a member of the communities that I work with and for in Scotland. In fact, the story that I'm telling has proven more complex and its ramifications more extended than I anticipated in the early weeks of the crisis. Back then, my fear was of a deluge of infections and deaths caused by the virus. And I didn't see then that this would become not just an account of a pandemic infection, but of the sudden warping of an entire way of life and of all those lives that have been thrown out of kilter and whose trajectories were now so uncertain. I didn't foresee how much the profession that I love would be bruised, transformed and reshaped to cope with the impact of the virus. This book is a contemporary history, an eyewitness account of the most intense months I've known in my 20-year career, a hot take on the pandemic that speaks of the tragic consequences of the measures taken against the virus as much as it tells stories of the virus itself. Crisis is a Greek word which originally described the moment in the evolution of an illness on which everything hinges, when death and recovery are held for a moment in the balance. The slightest nudge towards one or the other may determine the outcome. In hospital, the intensive care unit or intensive therapy unit is where the sickest patients, those whose organs are failing and who will die without drastic and intense interventions, are looked after. And those units do extraordinary work. But over the months of this pandemic, it has often seemed to me as if many other clinicians, scientists, carers, charity workers outside the ITU have been engaged in something comparably intense. It's frequently seemed as if society itself is on life support, and intensive measures, including huge efforts of selflessness, vision and compassion, have been required to sustain it. Care is something we do for others, but it's also an emotional attitude of attentive compassion, of kindness, and delivering it can be a privilege as much as it can also be a burden and a responsibility. I'd like to cast a modest spotlight on the care I've seen delivered in the communities I work with, a care that has often been delivered quietly, without headline news, in rural village streets, community clinics and communal city stairs. It's my hope that sharing some of those stories will help readers see more clearly what has been gained and lost so far through COVID-19 and what we're still in danger of losing. It's only by learning from this pandemic that we can better protect ourselves for the next one. So as I say, I hope very much this book acts as a guide over the last year and a half, and some of the most gratifying feedback I've had from it is that people feel as if it's helped them make sense of what we've all been through. It certainly helped me make sense of what we've been through over the last year and a half. I'm speaking now in September 2021. I'm just going to read a very short passage again from near the end of the book, and that describes some of that retrospective perspective. The Edinburgh Futures Institute, a body set up to promote interdisciplinary scholarship, asked if I'd give a talk on the opportunities the pandemic might offer to rethink how, as a society, we offer care. I began by speaking of how poverty and deprivation doubled your chances of death from coronavirus, but that because of the pandemic, we'd made a tentative start at solving one of the most intractable of society's problems: homelessness. I spoke of the immense difficulties that lockdowns impose on us as social, gregarious beings, of the sacrifices that had been made by the young on behalf of the old. I spoke of pride in the NHS and my colleagues in medicine, nursing and caring, as well as how inspirational it had been to see the way professionals have been allowed to get on and solve immense challenges like vaccine development, the acceleration of digital healthcare, the restructuring of our clinics and hospitals, and mass public vaccination. The seismic shock of the pandemic had opened up cracks in our society, and we had a responsibility to do more than just paper over those cracks. Recovery comes from a root meaning to regain consciousness. And the pandemic had made us acutely conscious of how interconnected and interdependent we are as human beings, how vital and undervalued the work of caring often is. No one's safe until we're all safe. Convalescence derives from a word meaning to grow in strength, and I hope that as society as well as the caring professions would ultimately prove stronger for the ordeal. Though many new doctors still swear by the Hippocratic Oath, the medicine practiced today is unrecognisable from that practiced 2,500 years ago. The aim of the Futures Institute was to promote dialogue between the arts and sciences, and I concluded my hopes for the future with a poem by James Robertson. Robertson invoked three ancient mythical symbols of medicine: the snake that winds around the staff of Asclepius, the centaur Chiron who taught medicine to mankind, and a cockerel of light. It offers a series of truths elegantly compressed and distilled. He wrote, "Your patient is your mirror, therefore look with sympathy. Work with the faults and flaws, see the stories and the scars. Replace what worn out parts can be replaced, and when remedy cannot be found, in the last resort, be kind. The world needs all the kindness it can get. Our time is short. The snake casts off its skin. The cockerel calls up the morning light. We glimpse the centaur leaping in the wood. We work, we live, we love, we say goodnight. But not just yet. Although I will now disappear, life is what you are for and why you are here."